Turmeric for back pain, a good and natural treatment. Back pain is one of the most repeated excuses for missing a day of work. According to global back pain statistics, 7.5% of the population worldwide suffers from lower back pain. About 540 million people worldwide are affected by back pain at any time. It is predicted that 4 in 10 office workers will undergo lower back pain inflammation. Current non-surgical treatments for back pain conditions are neither effective nor safe. As a non-toxic natural product, curcumin in turmeric has a premium anti-inflammatory profile that reduces back pain and inflammation. Radicular back pain is one of the common causes of lower back pain. Researchers observed that curcumin alleviates radiculopathy by reducing neuroinflammation, oxidative stress, and nociceptive factors. We'll discuss whether research confirms this effect, the dosage shown to have a beneficial impact, and any side effects that you should look out for. What causes back pain? Sitting too much can lead to debilitating pain in your lower back and other parts of your body because it causes poor posture and tight muscles. Sitting also puts pressure on discs between vertebrae in the spine, which can cause them to degenerate prematurely. Also, it restricts blood flow through veins while disturbing proper nerve function. The most common cause of back problems is muscle or ligament damage. Torn or ripped tissues can inflame, resulting in pain and less movement. Muscle strains are also common causes of back pain that can result from overstretching and pulling muscles during exercise. Historically, turmeric, together with its active ingredient curcumin, has been known for its anti-inflammatory effects. But do these ingredients truly work, and can they support the muscle tissue harm linked to back pain? Is taking turmeric for back pain safe? Turmeric has been used for both culinary and medicinal pursuits for centuries. Various studies in recent years have used doses of 1,125 mg to 2,500 mg over an extended period without noting any issues. During this time, no adverse cases from long-term use. Even more extreme, one thorough analysis gave participants an astonishing 8,000 mg of turmeric per day for 3 months. Once again, participants showed no symptoms of toxicity. Even in large doses or when taken over a long time, the side effects are mainly on par with volunteers consuming a placebo. Consequently, turmeric owns respect within scientific circles for its high safety profile. How to use turmeric for back pain? Rigorous studies have shown that turmeric positively impacts inflammation, but there is an issue. Firstly, it isn't alone, which is wholesome. Instead, a unique chemical, curcumin, is present in it. The amount of curcumin present within turmeric powder can vary greatly. Therefore, it is considerably safer to assess the curcumin dose than turmeric. Secondly, the liver metabolizes curcumin very fast. This means it filters out the body quickly, and absorption is low. The result is minimal or no beneficial effects. For example, a recent study that gave participants 4 to 5 grams of curcumin showed that levels peaked between 1 and 2 hours after consumption and fell rapidly thereon. Luckily, there is a solution to this apparently bad news about curcumin's absorption. Combining curcumin with a second ingredient, piperine, increases its bioavailability. Piperine is the active ingredient in some black pepper varieties, so a piperine/curcumin complex generally induces the most potent results and long-term health effects. The average dose of roughly 200 to 600 mg of curcumin seems beneficial based on former and later studies. This is much equal to around 2 grams of ordinary turmeric powder. As we have seen, however, taking higher doses is unlikely to cause ill results, so some people with unbearable back pain settle to consume more. Our turmeric curcumin with ginger and bioperine capsules contain the exact amount of curcumin extract, so you can really pack a punch. Your risk of developing back pain may increase if you are overweight. It's important to note that curcumin is less effective in people who are overweight because it has a higher risk of stored fat cells. If you are overweight or have high blood sugar levels, the curcumin you take may not absorb so quickly. While more research is needed to fully understand its effectiveness for back pain, it is generally considered safe. Just remember to always consult with your healthcare provider before trying any new treatment, especially if you have underlying health conditions or are taking other medications. Thank you for watching, and be sure to leave a comment below if you have any questions or experiences to share.